Welcome to Dr. M's Experienced Functional and Sports Medicine podcast. I'm Dr. M or Dr. Musnick, and this is podcast number 2. And the topic is brain fog. So this is actually brain fog number 2. This is going to be about 20-ish minutes. It's going to be a solo episode. And let's get going. Okay, so I'm going to summarize a little bit from Brain Fog Part 1. In Brain Fog Part 1, I basically said that brain fog was a dysfunction in the brain, definitely brain inflammation, definitely slowing of neurotransmission, where a person feels foggy and slow and mental processes are not normal. I also said that brain fog can either be, quote, simple brain fog, where that's all it is, or it's associated with other cognitive issues like memory issues, focusing issues, word finding issues, speech issues. In other words, brain fog plus other cognitive issues is much more serious than just simple brain fog. We also said that brain fog that lasts more than 15 to 20 minutes is more serious than very brief episodes of brain fog. We went over a whole list of things that can cause brain fog. Everything from brain inflammation, food allergies, EMF exposure, heavy metals, Lyme and co-infections, viruses, autoimmune conditions, even autoimmune conditions of the brain. So make sure if you haven't listened to part 1 that you listen to it, because it's really a preliminary episode to this. What we're going to cover today is, are there any tests that you might want to get in regards to checking out your own brain fog, or if you know someone who has it that they might want to get? And then what are some basic solutions? Now, when I talk about solutions, first of all, it's very important to talk about the cause, because if someone has Lyme disease or they have Epstein-Barr, we definitely want to get at the cause and treat those things. And it's outside the scope of this particular podcast to tell you how to treat Lyme disease or tell you how to treat Epstein-Barr. So one of the initial concepts is, when we get into talking about treatment, that you need to understand that there's going to be treatment that's going to go on depending on what the major causes are, but also I'm going to make recommendations of things that you can do regardless of what's causing it. Okay. Now, first topic we're going to talk about is, are there important tests to get for brain fog? And the answer is yes, there are some important tests. Let's first talk about blood tests. What blood tests could you get that might be meaningful? Well, you could get what's called a sedimentation rate to check for inflammation, to see if there's high levels of inflammation that could be contributing to the brain fog. Because did you know that body inflammation can lead to brain inflammation and then brain fog? And it appears that almost all brain fog is related to brain inflammation as one of the different physiological factors. So the other test you could get is called a CRP, high sensitivity. And that will also give an indication of inflammation. You'd like a level less than 1 on that. With the SED rate, you'd like a level less than 12. What other tests can you get? Well, certainly you can get cholesterol testing, and you can get really refined with the cholesterol testing, because that would relate to blood vessels in the brain. But forgetting about all that cholesterol testing, there are other things that you could test. You could test homocysteine to make sure that's not elevated. You could get a test for Epstein-Barr, because if Epstein-Barr is reactivated, that can cause brain fog, and it can cause what's called brain fatigue, which means you don't want to use your brain all day long. So Epstein-Barr virus, we initially contract when we get mononucleosis, but if the immune system is not functioning as well as possible, we can get a reactivated Epstein-Barr. What does that mean? It means the Epstein-Barr, which was contained and dormant, is now multiplying, and it can multiply in your brain and cause brain dysfunction. I've had numerous patients where that was the big deal. So, what test do you want? Well, it turns out that the Epstein-Barr panel is not enough. So, let me tell you the exact tests you need. You need a antibody to Epstein-Barr VCA, which is viral capsule antigen. You need Epstein-Barr nuclear antigen, which is abbreviated EBNA. You need Epstein-Barr early antigen. All of them are important. And if any of them are 8 times the normal upper limit, then you've got a reactivation of Epstein-Barr and it needs to be treated. Remember, there is no drug for Epstein-Barr treatment. So at some point, we might have a podcast on Epstein-Barr because there are ways to treat it. So just know it can be treated. What else? If there's a suspicion of mold or mold mycotoxins causing brain fog, then you want to get a urine mycotoxin test. And there's a number of laboratories that do this. Number of laboratories. Mosaic Labs does this. Vibrant Labs does this. There's a number of labs that do this. What other tests might you get? Is an MRI appropriate of your brain? So let's just cover this real quick. An MRI is not initially appropriate for brain fog. An MRI should not be done with contrast because the contrast itself could be harmful for the brain. So I recommend that you stay away from MRIs with contrast for the brain because the contrast is a heavy metal, okay? And MRIs do not usually show things revealing the cause of brain fog unless somebody thought that you had a brain tumor. So let's stay away from that. Same thing with a CAT scan. It doesn't make much sense. What other testing might be appropriate? A vitamin B12 level would be appropriate because if vitamin B12 is really low, that could lead to brain and nervous system dysfunction. So those are basic tests, and there's certainly more tests like you could get a food allergy panel with IgG and complement and IgE, and that would be very appropriate in regard to brain fog. Another test that could be appropriate depending is a leaky gut test. As well as celiac testing, that could be appropriate because did you know that if someone has leaky gut, they're probably also going to have a leaky blood-brain barrier, and that can cause brain fog. Another test, but this would be more of a specialty test with a company called Vibrant Labs, would be a NeuroZoomer Plus. Why? Because that is a test for antibodies to the brain. Now, would that be a first level test? Not necessarily. But if somebody cannot figure out the reason for your brain fog, then that's a very appropriate test to do. So I would say, beyond these basic tests, because you could, if someone suspects Lyme or Lyme co-infections, then you're going to need a highly specialized test for that through a company called IGenics or Vibrant Labs. There's a number of companies that do very advanced specific testing for Lyme and co-infections. So those are the tests that I could recommend for a person who's trying to figure out the causes. Another test, which you might not think is a test, is to hire a technician that's trained in building biology to go into your home and measure, quote, electromagnetic fields. That also includes radio frequency fields, electrical fields, and electromagnetic fields. That can be extremely valuable because if they find them, which they will, and then they tell you how to reduce them, that could greatly help. Okay. Now, let's talk about what could you do or somebody else do that has brain fog, no matter what the cause. Okay. Well, one thing I'm going to recommend is that you decrease exposure to electromagnetic fields because that could decrease brain fog. So here's some basic suggestions or things that could be very helpful. Number one, decrease your exposure to Wi-Fi and try not to sleep with Wi-Fi on. So at least turn the Wi-Fi router off while you're sleeping. There's different ways to do this. You can put it on a program or you can flip the switch, but I highly recommend doing that. Number two, do not sleep with a cell phone near your head unless it's in airplane mode. Number three, do not sleep with a TV remote control near your head because they have Bluetooth in them and that can be harmful for the brain. So keep those things at least 10 feet away from your head. Number 4, do not sleep with the TV on while you're sleeping. Some people watch TV to fall asleep, which is not a good idea anyway, but the TV can put out electromagnetic fields, especially if it's controlled by a wireless network. So, another thing that you can do is stop wearing or decrease the amount of time you're wearing these ear pods that fit in the ears that don't really have any wires. They're Bluetooth devices. That can help. And another thing you can do is decrease Bluetooth. So use wired things like a wired keyboard, a wired mouse. I know it sounds old fashioned, but decreasing the total amount of electromagnetic fields. So I am going to tell you about something right now, which is there are some devices out there that might decrease the harmful effects of electromagnetic fields on your body. One of them is a company called Tech, and they have developed a technology that you can wear or put in a pocket that will create scalar energy waves that will decrease the harmful biological effects on your body. So at the end of this podcast, we're going to have a link and an affiliate code that you can use to order either something called the Flex or the Zone to protect yourself. Okay, next. What about how you eat? Well, there's some things you could do in terms of how you eat. I'd recommend decreasing toxins with how you eat. So try to switch to mostly organic and non-GMO. Next, if you decrease grains, especially gluten, that could be helpful. And decreasing dairy can be very helpful too. There's some issues with gluten and dairy and a lot of people with brain fog. So you could just try getting off of those for a month and see if it helps. Next, believe it or not, parsley could be one of your favorite foods. Do you know what parsley does? Parsley helps the microglial cells switch its morphology from the inflammatory stage, the M1 stage, and also in the M1 stage, those microglial support cells in the brain, they don't produce much growth factors. Parsley has apigenin in it, and that helps convert the microglial support cells to the more favorable form of the M2 phase. So how do you get parsley in your diet? Well, get some organic parsley and chop, the stems off of it and put it in a smoothie. As a matter of fact, a really good smoothie for the brain is wild organic blueberries with parsley, then a protein powder, and then a really clean liquid. And why wild frozen blueberries? Wild blueberries have more purple pigment in them. That purple pigment can be very good for your brain. So the ideal smoothie is going to at least have a minimum of wild frozen blueberries and parsley. Now, how else can you get parsley into your body? Well, you can put it on your salads, but you can make a pesto with it. So one of my favorite pestos is to take a pesto maker, use organic olive oil, then literally take a whole head of organic parsley and put it in there. Put some pine nuts or some other nut of your choice, like walnuts or something, and then grind that up. And then add cilantro, because cilantro is also detoxifying heavy metals, but it's got some good flavonoids in them. And then if you really want to up the ante, add some broccoli sprouts, because sulforaphane in broccoli sprouts is very good for detoxification. Also, it activates NRF2 factor. The NRF2 factor is anti-inflammatory for the brain, so you'd like to activate that. There's many ways to activate it. You can activate it with this pesto that you're making. You can activate it with curcumin. So I'm going to talk to you about curcumin shortly, but you can activate it with green tea. There's a number of ways to activate it, but you do want to activate NRF2 if you got brain fog or any cognitive impairment, because that's your body's natural anti-inflammatory, antioxidant system. Okay, so if anybody says, what are you doing about your brain fog? One thing you say is, I'm activating NRF2. They say, how are you doing that? Well, I take some curcumin. I drink some curcumin tea. You can also activate it with DHA fish oil. You can activate it with cardio aerobic exercise. There's a lot of ways to do that. Okay, so let's talk about what else you can do as a foundation thing. Take some curcumin that goes into the brain through the blood brain barrier. Why? Because curcumin is very anti inflammatory, both in the body and the brain. If you take the Longvita form, and there's a number of companies that have this form that will have a list at the end of this podcast for you. If you take approximately 400 milligrams twice a day, you can decrease brain inflammation, which is really important to do. It's really important to decrease brain inflammation. I recommend everybody do it. So you could do it with a capsule. Now, what if a child has brain fog? That's pretty serious. They can take curcumin in gummies. So there are curcumin gummies. They're made by a company called Nordic Naturals. And the child will need 2 or 3 of those twice a day because each gummy has 100 milligrams of Longvita curcumin. So those gummies are a good thing for kids to have anyway because it will decrease brain inflammation. So those are really, really important. One other thing you can do is get some cardio on a regular basis. Cardio exercise increases brain-derived nerve growth factor, and that growth factor helps you build networks or connections between brain cells. So you need to be having adequate levels of BDNF. Very important, and aerobic exercise or cardio can do it. If you can't do aerobic exercise, well, you're going to have to figure out other ways to stimulate BDNF. I'll probably have that in another episode of our podcast. Okay, what about sleep? Sleep is extremely important. You want to get more than 7 hours. 7 hours is about the cutoff because the studies have shown that less than 7 hours is associated with body and brain inflammation. So you want to get more than 7 hours. You want to get enough deep sleep. The other thing is you'd like to get some hours before midnight. This time before midnight is just extremely valuable because did you know that growth hormone is secreted after like 1 a.m. if you go to bed around 10 or 10:30? So in general, I don't want people going to bed later than 10 or 10:30. We want that growth hormone. It's good for your body. It's good for your brain. And so other things besides getting enough sleep, decrease your stress level if you can. Stress increases cortisol. Cortisol, if it's too high, can be a cause of brain fog and even a cause of memory problems. So somehow you want to manage your stress. Many different ways to do it. I do suggest meditation, but I really like this app called the Tapping Solution. I suggest you download it from the App Store. We're going to give you a link on the end of the podcast. And I would say upgrade it for a year because it's unbelievable how this tapping decreases stress. There's another way to decrease stress, which is that there's a program called HeartMath, where you actually download an app and have a little thing that connects to your ear, your finger, that measures your heart rate variability. And then you do a thing called getting into coherence, similar to meditation, to decrease stress. And then, of course, to decrease brain fog, you want to treat the cause. If it's food allergies, stay away from the food. If it's Lyme or co-infections, those need to be treated. If it's Epstein-Barr, that needs to be treated. If it's mold, that needs to be treated. There's a lot of things that you could start doing, like we just mentioned, and then treat the underlying cause. And that's the way I recommend doing it. Do some of these foundation early things, and oftentimes the brain fog will just go away. Another thing you can do is support the mitochondria in your brain through taking a really good multiple vitamin and taking some CoQ10. And then sometimes methylene blue can be very helpful for the mitochondria, but you got to make sure you get a really good source for it. We'll have a list at the end of the podcast for a source that I like. And you want to make sure that source is checked for heavy metals. Really important. So I hope this has helped. This helps you. There's so many suggestions here. I really wish you good luck on your search to treat your brain fog. And look at our other episodes of Dr. M's experienced functional and sports medicine, and look at the links at the end of this podcast for these products. And don't forget to subscribe to our podcast channel and our YouTube channel.